Before entering my patient's room, I am going to go ahead and prime my IV tubing. So I would select the correct tubing, and it's the primary set, and I would select the correct solution according to the doctor's MAR, and I check the expiration date and it's good. So I'm going to go ahead and get this ready. I'm going to open this first. I'm going to hold the two ends in my hand to maintain sterility. I'm going to untangle it so it's not going everywhere. I'm going to go ahead and clamp it down. Now I would take the blue end off so I can spike it, making sure not to touch that because that is sterile, and the spike is sterile as well. So I'm going to spike it. Okay. Go ahead and hang it up. And then give it a few squeezes. Okay, and that's good. So now I'm going to prime it, and to do so, I'm going to first get it untangled. And I would let it run through, watching it. And there it goes. Okay, so then I would go ahead and attach my lure lock, and since the end of this is sterile, I would open this up, making sure not to touch it because it is sterile. I would open this and put it down, then take the end off, and if I were to touch it, I would start over completely, and I just attach it, and I would keep the cap on. Now I would make sure there were no air bubbles, and I don't see any. So I'm going to hang this up, and I'm going to go to my patient's room. So I go in my patient's room. Hi, my name is Allyson. I'm going to be your student nurse today. Can I get you to state your name and date of birth for me? Alright, thank you, Mr. Jones. Today we're going to be, I would pull the curtain for privacy. Today we're going to be inserting an IV, and I'm just going to go ahead and wash my hands. Okay, so let's kind of just look and see where we might put one in. And I think for this, we're going to put it in your hand, right about here in the straight one. Okay, so I'm going to go ahead and get my things prepared. So I'm going to prep my syringe using a blunt tip.
Start off by priming the IV fluid.
I'm going to pull back some air, get the plunger kind of ready, and I would check the expiration date of the sodium chloride, the normal saline, and before putting it in, I would alcohol it to make sure that it is clean. Okay, now I would insert it, push some air, then turn it upside down and draw back some fluid, and I'm just going to pull back a little bit, so about 5. And that's good. So now I'm going to go ahead and open my extension set. and kind of get my trash to the side. I would open this, maintaining sterility of the inside, not letting it touch. I'm going to go ahead and grab the end that the needle goes in, stick it in. I'm going to prime it, so I'm going to push just a little bit of fluid until it comes out the other end. And it did. So now I'm going to set this here and take the cap off, making sure not to touch out because it is sterile, and I'm going to place it back in the sterile field. So now I am going to select the correct size gauge, and for this patient I think that Mr. Jones needs a 22 gauge. So I'm going to go ahead and open this kit. I'm just going to go ahead and dump it upside down. That's garbage. And I'm going to stretch my tourniquet, tear my tape. I'm going to tear 3 pieces and place it on a clean surface. And for my last piece, I'm going to actually tear it in half. Okay, and now I would get my Tegaderm, and I'm going to go ahead and initial date and put the gauge. November 5th, and the gauge is a 22. So I'm going to go ahead and pull this off and place it upside down. Alright, Mr. Jones, and are you allergic to anything like betadine, iodine, latex, chloroprep? Okay, that's good. So now I'm going to go ahead and put my gloves on. My hands are a little sweaty. So they would go on easier without the moisture. Having a little difficulty. Okay. Now I would go ahead and I'm going to open my alcohol swab, place it on top here, and put it here. So I'm going to apply the tourniquet 6 inches above the site of insertion.
And we're going to attach some normal saline to help you hydrated, to help you remain hydrated.
And I would pull tight and do a loop.
Alright, I'm going to wash my hands, put on clean gloves.
It's hard to do with gloves on. Alright, hang on. Can you hold the arm?
Are you allergic to anything? Any betadine?
Okay. I'm sorry, Mr. Jones. There we go. Okay. It's difficult. Okay. Now I would take my alcohol and I'm going to rub the site using different spots each time so I don't contaminate, and I'm going to do circles from the inside out, making sure not to contaminate, and if necessary I would wipe again, and I'm going to let that dry. So I'm going to go ahead and open my cannula. I'm going to brace myself to open it. There we go. Okay. And that's dry, so I'm going to go ahead and hold Mr. Jones's hand. and pull the skin tight. I'm going to insert the bevel up. You're going to feel a little stick, Mr. Jones. Alright, and I see a flashback. So now I'm going to slide the cannula off, making sure to steady the needle and not to bend the cannula. Okay, and now I'm going to occlude above, take the needle out, and I would place this in the sharps container. I'm going to undo the tourniquet. I'm going to attach my extension set without touching the end of it because it is sterile. I'm going to place it on there gently, and now that it's touched, I'm going to go ahead and screw it on. Alright, and I'm going to hold this, making sure to see above it. I would push normal saline to see if there's any infiltration or edema, and Mr. Jones doesn't report any pain, so that's good. Now I'm going to go ahead and apply a piece of tape over the hub, making sure not to press it down because we don't want it to bend. And now I can go ahead and apply my Tegaderm all the way up to the hub, making sure to smooth out the wrinkles. Now I'll peel the edges off. Mr. Jones, you doing okay? Alright, we're almost done here. And this would be pressed down flush to his skin. And I would attach the initials, date, and time, or the initials, date, and gauge to the side so I can still see the site. I'm going to go ahead and take my syringe off, and this would also go in the sharps container. I'm going to form a loop and tape it. Okay. Alright, Mr. Jones, this is uncomfortable, and I did a wide loop so it would not clamp it. Now I'm going to go ahead and attach the saline because I know this is the correct amount, and I programmed it to the pump. I'm going to go ahead and hook it up. Alright, and then I would tape it if it needed further taping, but I don't think it does. So, for removal, I would, or before that, I would make sure these were in the sharps container. For removal, I would turn off the pump, clamp it, disconnect it, hang it back up to keep it out of the way. Then I would peel the tape off, and if necessary I could use alcohol to help rub it off. Then I would peel the Tegaderm off with the tape. And I would, of course, make sure to have an order for this before I do this. And I would have washed my hands before and put on new clean gloves. Tape's kind of sticky. Okay. It's not coming off. Okay. So now I'm going to get a gauze, piece of gauze, 2x2 or 4x4. Alright, Mr. Jones, I'm going to take your IV out and I would cover it. Make sure to pull it out. Then I would inspect the cannula or the catheter to make sure it's intact, and it is, and I would dispose of this properly. And I would give him a Band-Aid if necessary. And that's it.